Hello, my name is Adriana Marino, and I am host and producer of Ben Into Balance, powered by The Source. Today, I am very happy to be accompanied by Dr. Kevin Jones. Dr. Jones began in emergency medicine before starting Flow Wellness here in Bend 3 years ago. Can you tell us a little bit about Ozempic and the GLP-1s in general, how they began, how long they've been in the market? Because many of us think Ozempic as a household name, like just in a couple years ago, but it's actually been around since 2005, if I'm not mistaken, or these type of drugs at least. Can you give us
Correct.
a
Yeah,
little
they
bit?
were first developed for diabetics to help manage blood sugar, which is something that Ozempic does do. And it was really a incidental side effect that people were losing weight while taking this medication. And the initial drugs, the one that were around in the early 2000s, you had to take either once or twice a day. And so for weight loss, that's not a very appealing thing. But for diabetics who rely on insulin, they're used to
Sure.
doing daily shots. So it wasn't a big thing for them to take those medications.
Uh-huh.
And what really changed is when they were able to make the medication last longer from daily to weekly and then start looking at it just for the sole purpose of weight loss. And the original medicine for that was called semaglutide or semaglutide,
Mm.
also known as Ozempic,
Okay.
which and then that just, it just hit a tipping point where people realized it was effective and for the most part safe with, not there are some side effects, but most people can manage them. And now there's newer medications like tirzepatide, which is also called Mounjaro or Zepbound. There's pills now available where you don't even have to do the shots.
Okay.
And then there's even newer medicines out there that are approaching like what the level of bariatric surgery is for weight loss. And so it's just a real exciting field to be part of and see where it's going.
Wow, it's really grown fast in such little time.
Yeah, I mean, the tragedy with obesity is that it affects so many parts of people's lives. It's linked with higher risk of heart disease, cancer, stroke, longevity, and there just really wasn't a treatment for it.
Yeah.
We would, I mean, not so much in the ER, but primary care doctors would say, well, exercise more and eat better, but that only gets you to a point, and then with ultra processed food, it's pretty hard to monitor calorie intake. And so we were, even though people were trying, this is what I hear from a lot of the patients that I've treated,
Mm-hmm.
they're doing their best, but just not getting where they want to go.
Yeah.
And also just middle age and getting older, your body slows down. So for a lot of people that were at a healthy weight, that changes over time. And now we have this medication that can help people get to where they want to be and feel like themselves again. It's really phenomenal.
Yeah. This reminds me of in my past, I was a filmmaker and I did a 1 hour special for National Geographic on obesity. And I went to Monterrey, Mexico, and I met at that time the world's largest man.
Oh,
His
wow.
name was Uribe, Miguel Uribe, and he got the Guinness record of being the heaviest man, and he was at almost 600 kilos, which is close. I'd have to do the math, but I think that's over 1,200 pounds. And when I met him, he had been living on a mattress for the last 13 years. And on that mattress, he had to do everything, all his bodily functions. He could not get up from that mattress. And he had been literally bedridden for 13 years. And if he wanted to see the sun and get out, they had to transfer that mattress to the back of a pickup truck. And then they would drive him through town and he would just kind of be exposed to the sun and, of course, to the city. He was obviously well known. A lot of people went to go visit him. Anyways, he sadly passed away a couple of years later, but I don't think he reached I think he died around close to 40, if I'm not mistaken. He was probably in his late 30s when I met him. But it was a very impactful experience to see him just really glued to that mattress and knowing that he had been there for 13 years was very hard to conceive. So that brings me, to the need of why these drugs could be useful because he was unable to lose any weight. Can you tell us, when a patient comes to you, like what are the factors that you're keeping in consideration as to why this patient should be eligible or not to take these new medications?
Yeah, it's a great question. There are criteria which we base off of the body mass index, which is a calculation based on your height and weight.
Mhm.
And then also factoring in other risk factors, mainly for heart disease, like does that person have diabetes or high blood pressure or bad cholesterol or a family history of heart disease? And so those are the kind of traditional things that we look at for GLP-1 medications. We are seeing it used a lot more commonly now for other conditions, mainly in the longevity space. There was a large study that showed semaglutide, which is the original weight loss medication, had a 15% drop in all-cause mortality for people who took it over a study period.
Uh-huh.
And so people are looking at this, say, hey, I can actually use this medication to help live longer There was a large study looking at it for dementia, which didn't really pan out. So that's still up in the air.
Okay.
We've also had patients use it for inflammation,
Uh-huh.
like pro-inflammatory states of the body. And, fat cells are pro-inflammatory. And so if you can lose weight, you can decrease that inflammation.
Sure.
And so we have the traditional things, which is just truly excess weight, like a
Mhm.
BMI over 30, whereas over 25 is considered obese,
Right.
or over 25 is considered overweight, over 30 is obese. And then also folks that are looking at it for kind of what we consider like non-traditional treatments as well,
Okay. And non-traditional treatments would be like what?
like the inflammation
Okay.
components. Fertility, like we've had folks become pregnant after losing weight because being overweight is not that doesn't put your body in the healthiest state to have children.
Uh-huh.
Mm. Yeah, and there was a recent New York Times article about someone using it for a head injury, which is new to me. I hadn't heard of that, but who had a severe concussion and actually found getting on a GLP-1 medication helped their concussion symptoms. So it's in the news right now. There's just a little bit of everything that you're hearing about the
Uh-huh.
how GLP-1s can help, and maybe not all of that is 100% accurate. It's going to be
Yeah.
backed up by study data, but we are seeing a lot of benefit for things that we didn't even know about.
Okay. And the patients that come to see you here, in general, what are in what category do they fall in? Like the non-traditional or more just weight loss, looking for longevity benefits? What are you
It's really a
finding?
mix of both. I would say on average, it's an older population for the most part. We're mostly seeing people 40s, 50s, and even a handful of 60s, 70s.
Uh-huh.
And the middle-aged folks are really what I hear over and over again is, "I was doing fine, I'm eating right, I'm exercising, I live in Bend, I get out," that sort
Yeah.
of thing. But I just the pounds just keep on adding on, and it's so true. I mean, it's statistically shown. I mean, people in middle age, people gain on average, roughly a pound a year.
Hmm.
No matter how hard you're trying, as your body's just slowing down. And, eventually gets that affects people. Either their exercise tolerance goes down, they have a health concern, maybe, a health scare of some sort, and they wanna get healthier. And
Hmm.
so what we're seeing is folks that, are hitting that point where like, I've heard of this treatment. I know I'm getting worse. I've done everything I can to get better. Like, would this work for me?"
Sure. Are there any red flags that you look for where you think that the drug is not compatible for that person?
I mean, the biggest thing we'd screen for is something called body dysmorphic disorder, which
Uh-huh.
is, people who are already very thin who wanna become more thin.
Sure.
And that's pretty obvious when they walk in the door
Yeah,
and
that they don't
or
need
what,
it.
their BMI is.
Uh-huh.
And surprisingly, that's very uncommon. Like, I can count on one hand how many people I've seen personally that, I'm just like, "This isn't a healthy situation for you."
Yeah.
We do have to be careful with folks looking at, like, the inflammation benefits, that they don't
Uh-huh.
lose too much weight. Because if we're treating something else, but the main effect is weight loss, and we don't want them to get unhealthy. And that's something we actually track with the body composition scans, so we can look at their muscle mass, their fat mass. A big buzzword right now in health is visceral fat, the fat
Yes.
that's around your organs,
Uh-huh.
because that's, considered more dangerous for heart disease. And so we can track that and see if it's getting better. And so people are looking at that. Well, how do I improve my visceral fat, whether that's with GLP-1 or something else?
Okay. So tell me a little bit of the process. A patient comes to you and you filter them, you ask the necessary questions, you understand that, they're eligible, I guess, for the medication. What does the process look like? Like
Yeah, so
how
first they meet with a provider.
Mhm.
If it's an in-person visit, we do a body composition scan. And when we meet with them, we're going to talk about like, what their journey has been. Like everyone has like when did it comes out pretty naturally. Like, when did you feel like at a healthy weight? When did that
Yeah.
change? And what do you think changed? And how's your diet? How's your exercise? And usually there's sometimes there's a trigger, like, someone I talked with today had an injury and they were gaining weight because they couldn't exercise again and they're waiting surgery.
Uh-huh.
Other folks, it's just the middle age factor. And then we spend a lot of time, most of the conversation is really about, the risks and benefits of the medication because there are important things to know.
For example, can you tell us a little bit about the risks and
Yeah, the biggest thing is these medicines do have side effects. And
Uh-huh.
so the most common being nausea. And so we want to warn people about that. And so, not eating too much at once and then, taking your time starting the medication. We also want people to lose weight in a healthy way.
Mhm.
We don't want them just shedding pounds by the week because that puts you in a starvation state and you start losing muscle.
Yeah.
Also, the way the medication works is it really just slows down your whole GI system.
Uh-huh.
And so constipation is very common. So we want to talk with people about that.
Okay.
Sometimes people paradoxically also get diarrhea. So
Yeah.
it basically just affects your gut. And there are more rare side effects, mainly more attributed to weight loss. But for instance, if you lose weight, that can increase your risk of gallstones, which can lead
Okay.
to a gallbladder infection, which can lead to surgery.
Uh-huh.
And we've had some patients need to get their gallbladders taken out.
Oh, wow.
But, the gallstones are composed of what's in fat cells. So as those fat cells start breaking down and into the bloodstream, they can lodge in the gallbladder. And there are more serious side effects, which we've really hardly seen any of, but like
Mhm.
pancreatitis, like any medication can cause inflammation of the pancreas, which can be life threatening.
Oh, wow.
There's a theoretical risk of a very rare type of thyroid cancer that was seen in rat studies. It hasn't been demonstrated in humans, but there is a warning on the drug label. So we do
Okay.
talk with people about that.
Sure.
And those are the main things in terms of like what we warn people about. Then of course we just talk about, dosing and like, what a healthy weight loss target is. And then we follow our patients pretty closely. We want to see how they're doing and adjust their dose as needed.
Yeah, that's what I was curious about. Like the following, the continue, how the care is provided for while they're taking the drug. Like with what frequency will you see the patients? What is an appropriate weight loss per week? I mean, does that really depend on what their initial weight is?
It does. I mean, on average, 1 to 3 pounds is considered a healthy weight. But on tirzepatide, the stronger medicine,
Mhm.
we do have some people who say have like 50 plus pounds to lose, and they'll drop like 10 or 20 pounds the first month, just really fast.
Wow.
We don't want that to be sustained,
Yeah,
but that can happen. But yeah, so we just don't wanna up people's dose too fast, but most people don't want that because if you're gonna feel pretty miserable.
sure.
Like, if you're not able to eat at all, you're just not gonna feel good, so,
Yeah.
we tend to it's just standard in medicine, start low and go slow, and I
Uh-huh.
just warn people that this is a process, it is a journey.
Sure.
You're not gonna get to your goal weight in a month,
Mhm.
and that it's a long-term commitment to this. And, whether it's, if you reach your weight in 3 months or 9 months or a year, this where this drug was studied was actually 17 months of study periods. They were planning on over a year to look at this.
Uh-huh.
And then also the big thing too is to talk about what happens when you get to your goal. What do you want to do next? Because if people stop these medications, statistically, they are going to regain weight.
Yeah, I read that normally half the patient will regain the weight back.
Yeah, it happens very slowly. And a lot of times people will still wind up under where they were before.
Uh-huh.
And so we wanna warn people that, it's not just like anything else, there's no permanent fix, there's no magic bullet.
Yes.
I would say it breaks down. We do have some people that get to their goal weight and then get back to their healthy habits and stay there. I mean, that's probably the biggest minority. We do have some people that get to their goal weight, they do well for a period of time, and then something comes up in their life, whether it's an illness or a family stressor or a life stressor, and they'll call us back and be like,
Mhm.
"Hey, I was doing great for 3 months, but can I get back on for a month or 2?" And
Uh-huh.
so they cycle a little bit, which is
Yeah.
fine. And then other people just really feel so much better on the medication that they just wanna stay on it, and then we just work them to a maintenance dose, like a lower dose, maybe a more affordable medication. And what people really find that the benefit is that's hard to explain until you've experienced it is the lack of food noise or cravings.
Yeah.
Because when you're living that life all the time, you don't think about it, but people get very food stressed. I know that was an issue for me when I was working night shifts in the ER. If I'd
Yeah.
always feel hungry because I was, using calories to get some energy.
Sure.
And when I started, I'd personally take the medication. And when I started, I did that noise just went away. And I was like,
Yeah.
wow, that was really like a big part of the background thinking in my life.
Uh-huh.
And now it's gone, and it's really nice.
Yeah.
And that helps with other things beyond food too. People have used it to cut back on alcohol use. That's being studied.
That's fascinating.
Yeah, and so I don't think it'll ever be a true, like, just take this pill or shot to get off booze, but
Yeah.
we do have people that cut way back on their alcohol use, and part of it is the mental craving, and part of it's the physical amount that you just can't drink a bottle of wine on a GLP-1 because your stomach's you're gonna feel terrible.
Wow. Now that you're talking about, all these, psychological benefits of not feeling that noise, that food noise, and the fact that it can help with people who have addiction to alcohol. Can you tell us a little bit about how they work? I find it fascinating what's going on metabolically in our body when we take these drugs. What's going on?
Yeah, so the GLP stands for glucagon-like peptide, and it's mimicking a natural hormone or peptide, I'm sorry, that your body produces. So every time you eat in your small intestine, you release GLP-1.
Mhm.
And that's basically telling your body that you're full. So it signals to your stomach, hey, slow down, we're good.
Yeah.
Signal to your brain, we don't need any more food. Unfortunately, that peptide, the natural occurring one, only lasts for a few minutes. So there's kind of some fun trivia about the GLP-1s that it was actually derived from Gila monster GLP-1. And so Gila monsters are these like lizard creatures that live in this American Southwest,
Uh-huh.
and they only eat, once or twice a month. So they have a GLP-1 that lasts a lot longer. And so the molecule that was isolated was called exeninin. I might be saying it
Mhm.
wrong.
Yeah.
And that turned into exenatide, which was the first GLP-1 that was released in 2005. So it was a derivative of this Gila monster GLP-1. And so that they found a way to make it last longer.
Oh,
And so
interesting.
when you do this, it's not a natural thing that you're taking. Like tirzepatide is not something your body naturally makes. It's a synthetic version of your natural GLP-1 that's designed to last longer in your body. So it resists getting broken down by other proteins.
Mhm.
And so that's why that feeling of fullness,
Yeah,
like
satiety.
lasts longer than a few minutes. Like it,
I see. And how long can that last then? I guess it depends on the doses, but
yeah, I mean, well, for these weekly medications, the
Mhm.
half-life is between 5 and 7 days. So you take the medication, you have a kinda lower level of GLP-1 is circulating. So I think that's where people also don't get those food noises because their brain's being told, "Hey, it's okay, it's okay." And one of the big misconceptions of GLP-1s is you can still eat and enjoy food. It doesn't affect taste or,
Yeah.
going out with friends or having a glass of wine. Like,
Uh-huh.
those things are all totally back to normal. You're just
Yeah.
not gonna have as much. Like, what I
Uh-huh.
often tell patients is you're gonna start bringing take-home bags from a restaurant, or maybe you
Yeah.
just split an entree with your spouse. You just don't need as much to feel full,
Huh.
and that's the biggest change, and it's just really simple. I mean, if you're taking in half as much calories, to use a rough number, then you're gonna, on average, lose weight.
Sure, of course. Now, when someone begins this medication, what are some lifestyle interventions that should be maintained? I mean, for example, exercise, proper hydration, managing stress, sleep, like where, I mean, as a health and wellness coach, I cannot not wonder about, what are these other, how these other interventions come into play just to make sure that, health and wellness is maintained and we're just not relying on a, as you say, a magic pill, a miracle drug to kind of do all the work for us. Like, what's the work that the patient still should do?
Yeah, absolutely. I mean, those are really important things for, body weight as well as long-term health.
Hmm.
We do offer nutritionists. People wanna work on their nutrition, because for some people, that might be their weakness is just, "I just don't eat healthy, and I
Sure.
need some planning on that." The biggest thing that we worry about with the medication is that as you're losing weight, you can lose muscle because your body's if it needs calories, it's gonna scrounge wherever it can get.
Yeah.
And so, obviously, it'll start with body fat, but it's also gonna pull
Lean muscle
yeah,
mass.
and so that's something we can track, and then we also really encourage our patients to start, exercising if they aren't already. The nice
Mhm.
thing is naturally, as people start to feel better, they start moving more,
Yeah.
which is a great benefit of the medication. It's like, if say someone who's, very large, like they just every time they get off the couch, it hurts, like it's
Uh-huh.
physically painful for them. And that pain's gonna go down, as they lose weight. In fact, the medication's being studied for like osteoarthritis, that sort of thing, to
Mhm.
help with that benefit. And so people do wanna do that, but we obviously encourage them, and we have an education program we use at our clinic, but, it's like, here's some strength exercises, and here's what you need for your long-term health. Sleep obviously is important. I mean, that's like
Uh-huh.
the most underrated thing for anything I think in longevity is
I
just getting
agree.
night's sleep, and it's so hard right now with social media and,
Uh-huh.
the world and doom scrolling and stress, and something I
That
struggle with a lot.
Yeah, it's something I most coach on as a yeah, it's very common just to suffer from lack of sleep, yeah. So there's a lot of things that you're recommending your patients to do
Yeah, and we check in with them monthly. I mean,
monthly?
we're in a slightly different model, where it's a concierge level. So we want to hear from our people. Every place does it a little bit differently, but it's a journey. So it's going to take time. It's going to take adjustments. What I will say in this community that people tend to know what they need to do. It's
Yeah.
they know where they slipped up, and so it's less of an issue than I thought, but it's always good to remind folks, it
Uh-huh.
takes sometimes it takes a little, like, push to, "Hey, just sorry, how are you doing with this?" Or, "Looks like you lost some muscle mass. How can we work on that?" We wanna keep you healthy. The last thing you wanna do is feel great and be back to your, regular clothes that fit, but be an unhealthy person. We don't want that.
Sure. Is there any kind of counseling that goes on with these patients? Just like, I don't know, psychological counseling about body image, about body weight. Does that tend to accompany this process at all? For those who have
Um,
suffered for being overweight or obese?
well, you hear a lot about how it affects marriages. As one person gets healthy, it really
Uh-huh.
changes the dynamic. In fact, we have a lot of people that come in that will start with us and then bring their spouse in like 3 to 6 months later.
Oh, interesting.
Because I mean, for folks that really struggle with obesity, I mean, it really affects every aspect of their life.
For
And when
sure.
when those things get changed, like they're obviously going to feel a lot better and want to change other things in their life.
Uh-huh. Can you think of any, obviously without any names, but like any stories that have really inspired you, that have really shown like the power of this medication, of how it can really transform a life?
There's been a couple. I mean, one that comes up repeatedly is for like one of my first patients had a hip injury and had gained a fair bit of weight. She was younger and she couldn't get her surgery because she was too overweight. And she's like, I'm in this catch-22 where I want
Mhm.
to exercise, but it's painful. I can't, and I can't get this fix that I need because I'm too heavy now. And so she was successful getting back to the weight that she needed to do to get her surgery, and then was fine afterwards. And now, she's not on the medication anymore.
She's not on it.
And I had a consult today with the same story, an older patient who's in the same situation of just, injury, can't, and if you think about it, if you hurt your knee or hip, it
Yeah.
has to be the hips that I hear a lot about. You can't, aside from swimming, you're pretty limited on what you can do for cardiovascular activity,
Mhm.
and getting back down is a goal for them.
And, so once they get down to that weight that they need in order to get that surgery, in order to, enhance that mobility again, do they stay off the drug? What usually happens afterwards?
It's really individualized when
Mhm.
people get to their goal. Yeah, that's like we always want to talk with people about like how they're feeling, what they want to try. I mean, I always encourage people if they're up for it to try weaning off the medication and see how they feel.
Uh-huh.
Because if you don't need it, then you don't need it.
Yeah.
But I mean, it's hard to know exactly, but I've sort of split it up into thirds. Like when I tell people this, like a third of people will stop and stay off of it. A third of people will cycle. A third of people will stay on it. I think that's probably a little bit higher than a third that people will want to stay on it just as a maintenance,
Sure.
just because they're feeling better. They've gotten to where they want to be. Maybe they tried stopping it for a month and those food cravings came back and they started gaining weight again.
Yeah. And for those who are able to who are in that third that are able to stop taking the drug altogether, like what are they doing in their time in terms of their lifestyle in order to keep that weight off and not need the drug anymore?
That's a good question. I don't hear from them that often
Uh-huh.
because our
Sure. Yeah.
services. But I mean, what I think they're doing is just getting back to where they were, like in terms of activity level.
Mhm.
I mean, I hear from a lot of patients, I just need a boost. I need a kickstart to get
Yeah.
where I want to be. And that's part of your body's, how it functions, that homeostasis where it wants to stay the same.
Uh-huh.
And that's been looked at like in the Biggest Loser TV show. They did a big trial or big study and they looked at those folks that lost like tremendous amount of weight, but their body's metabolism really slowed down and it wasn't reversible. And so it becomes really hard, especially as you're cycling between overweight and regular weight. Your metabolism is always keeping score of that. And so it does take some time to reset that if that's even
Mhm.
possible. And so, it takes a lot of discipline. I tell people it's easy to lose weight on this medication. It's hard to stop and keep it off, but you should know that going in
Mhm.
because, we'll be having this conversation in, 3 months, 6 months, a year, what do you want to do now? But knowing that if you want to stop and get off of it, all those benefits of the mental and the gut systems slowing down are gonna go away.
Mhm.
But I think with I mean, there are a subset of people that are super disciplined and they get that kickstart that they need, and then they can move forward with it.
Yeah. What do you see the future of these drugs? Do you think they're gonna become more mainstream? Do you think they're gonna be held back? How do you see them evolving to?
Yeah, for a while, I was worried that there was some, like, unknown side effect that was gonna come out and, because there's been diet drugs in the past that have later turned out to be dangerous, like fen-phen. But now that we've had, over 2 decades of this type of medication being out and available, and plus just, tens of millions of people taking the medication, I really don't think there's going to be one overall bad thing that's going to happen.
Mhm.
There could be more future side effects that we don't know about. It's always hard to tell with any treatment.
Yeah.
I do think that, I mean, the biggest issue for right now for a lot of people is price because insurance typically doesn't cover this medication until you're a diabetic,
Uh,
which is frustrating because you have to wait to get the illness that is caused by being overweight for it to get treated for it. And unfortunately, that's just, how American insurance work. It's more for sick care rather than health care.
yeah.
And so, these medicines are expensive out of pocket. The cost has gone down tremendously. Like when I first started
Uh,
doing this 3 years ago, it was over $1,000 a month. And now either with compounded medication or brand name medication, you can get the medication for, 300 to $500 a month.
okay.
So quite a bit less, but still, that's still a lot of money.
Sure.
I do think the cost will keep going down as there's more medications out there. I mean, I
Mhm.
think every drug company right now is seeing this as something that they want to get into.
I've heard a lot of pharma's into this now. Yeah.
Yeah, I mean, just to have a fix for really the most common medical problem in the United States. I mean, it's, over 60, 70% of American adults are obese. So being able to have an effective treatment for that is really revolutionary. And I think it's going to, as a whole, help our whole country, live healthier, live longer, just
Mhm.
because there's so many consequences of having excess weight.
Yeah. What are those biggest consequences? Because, I mean, we're getting into the issue of, like, metabolic health, which is definitely a big driver of a lot of disease that we see here in the United States.
Yeah, it affects all levels. I mean, the number one, disease that kills people is cardiovascular disease, and
Mhm.
certainly being overweight's a contributor to that. It's gonna, associate with high cholesterol, can lead to high blood pressure, all those risk factors for stroke and heart disease. A big one that I feel like is becoming more common is just the cancer element. Like obesity is linked to, I believe it's over 20 different types of cancers, particularly breast cancer.
Wow.
And so with those adipose, those fat cells being so pro-inflammatory, it's just kind of wreaking havoc in your body. And we're
Yeah.
seeing a lot more young people with cancer nowadays. And I'm
Mhm.
sure there's more to it than just body weight, but
Right.
that undoubtedly is a component.
Wow. Can you explain to me why, you've mentioned inflammation a lot, and inflammation is definitely a more common word, as that silent killer behind so many of these chronic diseases. How does the GLP-1s work in being an anti-inflammatory?
I think the full extent of it isn't honestly known, but
Uh-huh.
as you decrease fat cells, those are the ones that are producing a lot of inflammatory signals in the body. Obviously,
Mhm.
it's more complicated than that,
Yeah.
but that was a benefit. Like a lot of people didn't even realize that, especially like inflammatory conditions can be hard to treat because there's not like an easy fix. And
Uh-huh.
and we were seeing people with like endometriosis, irritable bowel disease, polycystic ovarian disease, like things that just didn't have good treatments that were really affecting people's lives and in a non-specific, like, very ill way, and they're getting
Mhm.
better. And, I mean, I think it's mostly through weight. There might be other mechanisms too. The GLP-1 receptor is in all over the body, and so there's
Uh-huh.
probably things that are still yet to be discovered for that.
Wow. It's interesting to see how much this it's growing, and at the same time, the industry and is still discovering all its benefits and possible outcomes at the same time. It's like, there's a lot known still, but a lot of interesting things that are coming out as people are more and more taking these drugs.
Yeah, and I think there'll be, as we get more targeted with, AI and all these things, like the medical therapy is just gonna keep on getting better in that regard. I mean, there'll always be an issue of affordability and access,
Sure.
but this is, I think, the tip of the iceberg of what's possible down the road.
Yeah. So in terms of wellness, how have you seen that these drugs have helped your patients in general? Like, besides the weight loss, what else is happening for them?
I always think of, like, they feel like yourself again. Everyone has that memory of when we were young and healthy, and we wanna aspire to get back to that point, which is always a hard thing to do, but
Uh-huh.
it helps put you on that path. Just, if you can wake up and be, pain-free moving throughout your day or doing activities that you like,
Yeah.
fit into clothes that make you feel comfortable again, those sort of
Mhm.
things. I think it's really a big self-confidence booster.
For sure. And changes a little bit dynamics in relationships, as you mentioned.
Yeah, absolutely.
Yeah. For you personally, you mentioned that it has helped you kind of eliminate that food noise that you were hearing before. What other benefits have you experienced
Well,
through?
I think for me, one of the most striking things is how well my athletic performance got better because I like to ski a lot, but I was,
Uh-huh.
always the slow guy.
Yeah.
And I was like, well, maybe I'm just, this is just me. But as I lost weight, I was like, oh, wow, like I feel much more athletic. I'm moving better.
Uh-huh.
And that was a nice side effect that I didn't really anticipate. I think by not having that food noise, you can also eat healthier because you're just not
Mhm.
eating whatever's right in front of you. So you can be more intentional.
That's a good point.
And so, I use that as a springboard for that element. I think it just makes you feel more confident, I would say. Like, that's been a big thing.